Good afternoon, everybody. We're going to get started in just a moment here. All right. Thank you all for joining us today for a webinar on the WA Cares Fund, the state's new long-term care insurance program for Washington workers. My name is Kristen Mackey, and I am the Community Relations and Outreach Program Manager for WA Cares at DSHS. Jeff, do you want to introduce yourself?
Absolutely. Thank you. My name is Jeff Kendall. I am a service delivery manager at ESD. We handle all of the exemption, elective coverage, and employer reporting piece. And with that, I'm going to kick it over to Marley, who can introduce herself.
Hi, I'm Marley Holbrook, and I work as an employer reporting specialist for Leave and Care. And it's nice to meet everyone.
All right, then we will go ahead and get started. So we have a presentation to start the webinar off, and then at the end, we'll be able to answer any questions that you have. Anyone who has joined us on a computer or using the Zoom app on their phones can submit their questions through the Q&A function at any point in the presentation. It looks like we do have a few folks who joined dial in by phone. If you joined by calling the phone number but want to ask a question, you can find the link to join by computer or the app in your email or on our website at wacaresfund.wa.gov/webinars. And we will have the slides and recording posted to the webinars page of the website as well. That's on your screen, and I will drop it in the chat so that you can have that for reference. And with that, we are going to go ahead and get started. So let's start by defining what we're talking about when we say long-term care or caregiving. Long-term care is help with activities of daily living, like bathing, eating, dressing, preparing meals, grocery shopping, and more. It does not include medical care, like doctor's visits and treatment for medical conditions. Long-term care covers a broad range of needs and circumstances, including younger people who are unexpectedly injured or who become disabled or ill. And a lot of people don't realize how many different services and supports are included when we talk about long-term care. We often think of long-term care as care in a residential setting, like a nursing home or assisted living, but it can also include care provided in your own home. And in fact, most people with long-term care needs can stay in their own homes with the right support. It's also very common for family caregivers to not realize that they are a caregiver. You might go to your mom's house a couple times a week to cook meals, drive her to appointments, and make sure she's taken her meds, all of which are common care activities. And the majority of this type of care is provided on an informal basis as unpaid care from a family member, a friend, or a neighbor. 70% of us will need long-term care at some point in our lives. And the problem is that it can be really expensive. It costs almost $36,000 per year for 20 hours of home care per week, which is the average that's needed by current Medicaid long-term care clients. And because long-term care is not medical care, it's not covered by health insurance or Medicare, except in very rare circumstances. And it's only covered by Medicaid after you've spent down your life savings to just $2,000. Even though it's a predictable cost, most of us don't have a way to pay for long-term care. The median household income for Washington seniors is about $56,000 per year. And 41% of Washington workers who are near retirement have no projected retirement income from a pension, 401k, or IRA. And another 42% have no pension and only enough 401k or IRA savings to replace 10% of their pre-retirement income. So paying out of pocket is often not an option either. This is especially critical because our population is aging rapidly. The number of people who are 85 and older, which is the blue line on this graph, will more than double between 2020 and 2034. There are about 820,000 family caregivers in Washington, and the majority work full-time on top of their care and family responsibilities. So there is an impact to caregiving in the workplace. Most working caregivers say that their care responsibilities have impacted their job in some way. Over half say that they have to go in late, leave early, or take time off to provide care. 15% report reducing their hours, and about 8% report receiving warnings about their performance or attendance. And while walk cares may seem like a new expense for workers, it's important to keep in mind that the current system, where we rely on unpaid family caregivers to provide the vast majority of care, has significant impacts on working caregivers and their families. Nearly 1 in 4 say that their health has worsened since they took on the role. On average, they spend about 25% of their own income on care-related expenses. And it's really common for caregivers to have to leave the workforce early in order to provide care. Caregivers who are 50 and older who do this lose an average of more than $300,000 in wages and benefits. And most working caregivers say that a program that paid them for the hours they provide care, like Walk Cares, would be helpful. With these challenges in mind and facing a projected doubling of Medicaid long-term care costs by 2040, the Washington State Legislative Executive Committee on Aging and Disability began a search in 2014 for a long-term care public policy innovation to solve this problem. In stakeholder interviews, the consensus was that a new program would need to be able to offer affordable long-term care insurance coverage, whether public, private, or some combination, provide meaningful front-end long-term care coverage to be able to benefit more people, and be financially viable and sustainable in the long run, as well as preserving and protecting the Medicaid program budget by reducing reliance on Medicaid long-term care for those who could reasonably afford alternatives. So after extensive research on both public and private options for helping people prepare for long-term care needs, the findings were clear. That a program like Walk Cares would result in almost everyone, about 88% of people, being eligible for benefits over the long term compared to private options that had limited potential to increase long-term care coverage. So with all of this in mind, in 2019, the legislature passed the LTSS Trust Act, creating Walk Cares. In 2021 and 2022, the legislature made improvements to the program's coverage and benefits. Workers began earning benefits in July 2023. And this year, the legislature gave workers the ability to take their benefit out of state if they move. And in July 2026, the benefit will become available to those who qualify. So let's talk about how Walk Cares works for workers. Walk Cares is an earned benefit, which means you contribute for a certain number of years in order to qualify for benefits. It's entirely self-funded by worker contributions, which go into a dedicated trust fund that's only used for this program. Workers contribute 0.58% of each paycheck to Walk Cares, and you can see on your screen what this looks like for the typical worker who makes just over $50,000 a year and would contribute $291 each year, or about $24 per month. You only contribute to Walk Cares while you're working. Contributions stop when you retire or if you become unemployed. Everyone is covered at the same rate, regardless of pre-existing conditions. And when it comes time to claim your benefits, you don't have to pay co-pays or deductibles, and you don't need to pay upfront for services. Instead, Walk Cares will connect you with contracted providers who offer the services that you want and pay them directly. This is what those contributions can look like over the course of a career. The typical worker income that we talked about is just about at the level of the green box here in the middle. And you can see that $290 in contributions each year totals out at $8,700 over 30 years. Everyone who is contributing to Walk Cares more than 500 hours per year is earning benefits, part-time and temporary workers included. And by contributing for a certain number of years, you earn access to the benefit amount. So there are 3 pathways that you can use to meet the contribution requirement. The first pathway is lifetime access, and this is the pathway that we expect the majority of Washington workers will use to qualify for benefits. To use this pathway, workers have to contribute for 10 years without a break of 5 or more consecutive years. And this pathway earns you access to the full benefit amount, which starts at $36,500 and will grow over time with inflation. The next is early access. This is for workers who haven't yet been able to earn lifetime access, but have a care need, particularly while they're working or soon after leaving work. And to qualify, you need to have contributed for at least 3 of the last 6 years at the time that you apply for benefits. This pathway also earns you access to the full benefit amount of $36,500. And then finally, we have a pathway that is just for near retirees. So if you were born before 1968 and are therefore near retirement as the program begins and unlikely to be able to qualify through the 10-year pathway, you earn 10% of the full benefit amount for each year that you work. So it's a prorated benefit amount. And for example, if you worked and contributed for 3 years, you'd earn 30% of the benefit amount, or just under $11,000 adjusted for inflation. Near retirees have permanent access to whatever percentage of the benefit amount that they have earned at any time that they need care. And they can also qualify for the full benefit amount through one of the other pathways if they meet those requirements. Once workers meet contribution requirements and need help with at least 3 activities of daily living, they get access to the $36,500 worth of services and supports. And with Walk Cares, workers get the flexibility to choose the services and supports that meet their needs. So that could mean in-home care or residential care in a facility like a nursing home or assisted living, but it could also include home modifications to make their home safer, assistive technology for things like medication reminders and fall detection that can help with some care needs. Walk Cares is really designed to help people age in place in their own homes as long as possible. That's what almost all of us want to do, and most of us can as long as we have the right supports available to us. Walk Cares also provides support for family caregivers in a variety of ways. You can choose someone who would otherwise be caring for you on an unpaid basis to get training and be paid, even your spouse. And Walk Cares can also help lessen the impact of care responsibilities on family caregivers by paying them for their time or making sure that they can get other support services. We get asked a lot about how far the benefit amount will go. And while it won't cover 100% of care for everyone, it would cover the amount of in-home care that the average Medicaid client uses right now for roughly a year. About a third of people need care for a year or less. So for those people, depending on what types of services and supports they choose, Walk Cares may be able to cover all the care that they need. And for others, Walk Cares provides the family with immediate relief and time to plan for future care costs. These are some examples of how someone might be able to use their benefit. You could pay a family member to care for you for about 10 hours per week for 2 years and get care supplies for a total of about $33,500. Or they could choose services to help them stay safely in their own home. They could purchase $15,000 worth of renovations like bathroom modifications or a wheelchair ramp to improve their home's accessibility, get an electric wheelchair or scooter, and have meals delivered for 3 years for around $26,800. Or someone who needs long-term care due to an unexpected injury could get 20 hours of in-home care per week for a year, plus transportation to appointments and crutches for about $34,600. We also have some great news from this legislative session. The legislature passed a new law that allows people to take their Walk Cares benefit with them if they move out of state. Under the new law, starting in July 2026, Washington workers can choose to continue participating in Walk Cares if they move. To become an out-of-state participant, workers must have contributed to Walk Cares for at least 3 years, in which they worked at least 500 hours per year, and they have to opt in within a year of leaving Washington. Like other workers, out-of-state participants will keep contributing to the fund during their working years. The state will create a process for out-of-state participants to report their earnings and pay premiums with a focus on making it easy for participants. And benefits will become available for out-of-state participants starting in July 2030. And with that, I will hand it over to Jeff.
Thanks, Kristen. For the employer overview, just want to touch on a few things here. Employers don't contribute to Walk Cares fund, but there are still some requirements. One being to maintain a record of exempt employees. The second being to collect premiums for those that are not have not provided a copy of their approved exemption letter. Also, a requirement is to report employee hours and wages and remit premiums to ESD quarterly. So the definition of an employer, employee, and remuneration are consistent with paid leave. So if you currently file your quarterlies for paid family and medical leave, the same definitions apply. They also apply to the definition of wages, which is the definition of wages also applies excluding the Social Security tax cap, which does not apply for the Walk Years program. Next slide. So private insurance exemption, the law states, well, we can't accept these applications after December 31st of 2022, and there was no exceptions to those dates built into the law. So for those that have the private long-term care insurance exemptions, they were all done prior to the November 1st, 2021 date, and they are permanent. Next slide. Beyond the long-term care exemption, there's also a few others. But employees have 90 days to inform ESD and their employer once they no longer qualify for one of their conditional exemptions. The circumstances under which their exemption must be canceled by notification to ESD and their employers are: one, their spouse or registered domestic partner is separated from the military service, or the marriage partnership is dissolved. Two, their immigration status changes and they become a permanent resident of the United States. Or three, they change their permanent residence to within Washington. Now there are the three new pathways as of January 1st of 2023, which includes veterans with a 70% or greater service-connected disability. There's one for non-immigrant visa holders, spouses and registered domestic partners of active duty service members, and out-of-state residents. Those are the categories under which we currently grant exemptions. For the application process, it's actually quite simple. You gather the required documentation, you create an exemptions account, and all those details are at the link, the walkcaresfund.wa.gov/exemptions. Next slide. So as an employer, the employee is required to provide to you a copy of their approved exemption letter. It's your responsibility, it's the employee's responsibility to apply and provide you the copy. Once notified of an employee's approved exemption, employers must keep a copy of the employee's approval letter on file and not deduct the Walk Years premiums from exempt workers. Employees aren't entitled to a refund of premiums withheld before their approved exemption was effective or before they provided their approval letter to their employer. The letter, it will, once the employee provides the approval letter, the effective date of the exemption has passed, the employer must stop withholding premiums. If the employer continues to withhold premiums, the employer must return those premiums to the employee. Employers are not required to stop withholding premiums until they receive a copy of the letter from the employee. Next slide. And with that, I'm going to turn it over to my counterpart here, Marley, to talk a bit more about the employer premium withholding. Thank you. And Marley, you are still on mute.
All right. So I'm going to go over some information that we've already talked about, but it's all very important. So Walk Years premiums for employees are calculated at a flat rate of 0.58% of the employee's gross wages. This is excluding tips. Washington employees, everyone must participate in the program unless they have an approved exemption on file. And the employee is responsible for the full premium. Although employers are not required to pay any share of the contributions for employees, you can elect to pay for some or all of your employees' share on their behalf. And most requirements for reporting are the same between Walk Years and paid leave. Two key differences is there is no Social Security wage cap for Walk Years premiums, And unlike paid family and medical leave, there are no voluntary plans for the WellCares plan. Next slide, please. So with reporting, there's no separate report. WellCares is included with paid leave reporting. There's no need to create a new or separate account. Use your existing Secure Access Washington account for reporting and payment. Starting Q3 of 2023, new information was needed for WellCares. In addition to the employees' wages and hours and information on the slide, we need their date of birth and their WellCares exemption status. And that needs to be a Y, an N, or blank. So if there is not a yes or a no and the field is blank, we assume that the employee is participating in WellCares, and we will assess a premium for that employee based on their gross wages. And also beginning with that Q3 2023 report, the new file specifications, the version 8, incorporates everything required for WellCares. There's more information on the reporting specifications, templates on the paid leave website. Next slide, please. So for our filing methods, the method that you can use to file your report is determined by the number of employees you're reporting for. You can manually enter up to 50 employees individually, and if there are more than 50, we require a file upload. The CSV template and filing specifications are found on the website, paidleave.wa.gov, and you could just search specifications in the search box. You can also test your file before submitting, but make sure you remove all of the identifying employee data, because this is not a secure process. When you actually submit your report, that will be secure. And this screen shows you where you're choosing from your filing method. So right here, you would choose the year and quarter of the period you're reporting for, and then you select the type of report that you're going to be filing. Something important for the last few quarters is this is where you report no payroll if you had no employee hours or wages to report for the quarter. And if you do that, you can forestall any potential phone calls asking about that, and automated emails saying that you didn't file a report. Next slide, please. And regarding payments, payments for WellCares and paid family and medical leave must be made separately. So there's 2 payments, one for paid leave and one for WellCares. These payments go to separate funds and are processed by different payment processing vendors. And so they do require that separate address and separate payment there. We can accept payment by ACH, credit card, or by check or money order. Payments via check or money order for WellCares are mailed to a different address than payments for paid leave. But you can download a payment coupon after selecting the Pay WellCares Premiums button here on this screen. And also, please keep in mind that WellCares and paid leave payments may process at different times, and the confirmations may look different. Next slide, please.
All right. And next, we just want to highlight a handful of resources that may be helpful for businesses for more information. First of all, these are a few key links that we've talked about so far, where you can learn more about employer responsibilities, employee exemptions, and reporting. And next, we know that you may be still getting questions from workers about WellCares, and we want to make sure that you have what you need to answer them. So we do have some materials for employers, business and professional organizations, community groups, and anyone who needs to communicate about WellCares on our website at wellcaresfund.wa.gov/toolkit. Many of these materials are available in multiple languages if you have a large number of employees whose primary language is not English. And then we also want to direct you to our mailing lists. So we have 2 different mailing lists that you can sign up at. One is the WellCares email newsletter, which includes monthly updates, event announcements for things like this webinar, and notifications when new resources like toolkit materials are available. And then ESD also has a fantastic employer newsletter that provides monthly updates on WACARES, along with info on other programs like paid leave and unemployment insurance. There are links to subscribe here on the slides, which will be posted online, as we mentioned before. And they are also included on the toolkit page if you want to go take a look. And with that, we are going to go ahead and move into Q&A. Let me go ahead and stop my screen share. So our first question, we have someone who is asking, we're a new employer to Washington, and we have one remote employee who has provided us with an exemption letter from WACARES. As an employer, is there a way for us to verify this letter? And if they are exempt, do we still have a reporting responsibility?
I can go ahead and field that one. For the first part, to verify, you could call us and we can get a copy of the letter and confirm its authenticity for you. That part's not a problem. And do you still need to report? The answer would be yes. The employer reporting would still be required, only you would just mark exempt for that employee and not submit any payment for it, but you still need to file the report that the employee is indeed exempt.
Thank you. And then we've got someone asking if we're saying that workers can use WACARES benefits to pay for family member care. Yes, that's correct. We will have hopefully multiple options for how people can make a loved one a paid family caregiver. And we're still working on details of those processes. And then we have someone asking, I have an employee born prior to 1968 who plans on retiring July 1st of next year and moving out of state upon retirement. So if she doesn't have 3 years of contributions, is her benefit 0, but still needs to contribute? Jeff, do you want to, or ESD, do you want to take that one?
So it's my understanding, and correct me if I'm wrong, is it's prorated for the amount of years, but there is the 3 years minimum. Is that a minimum?
So the 3 years minimum, that's actually a great question. Let's follow up on
Let's
that,
follow up
because
on that one.
that is a specific situation where there's a requirement for portability, for taking your benefits out of state, and the law that's a little bit different. As a general rule, people born before 1968 will have earned a prorated benefit for the amount of years that they contribute. So we'll follow up with you by email. And anyone whose questions we don't get to today, we will follow up with you after the webinar. Then we've got someone who is asking whether about for taking your benefits out of state, for out-of-state coverage, whether it's true that in-state residents must require help with at least 3 activities of daily living to qualify for the care need requirement, but in the future, out-of-state residents will only need to require assistance with 2 activities of daily living to meet the care need, and what the reason is for that difference. So the care need requirement is different for out-of-state beneficiaries. It is a slightly different list of activities of daily living. And there's also another option. You must either be unable to perform without substantial assistance from another person at least 2 of the following activities with the need projected to last at least 90 days. And those activities are eating, toileting, transferring, bathing, dressing, or continence. Or if you require substantial supervision to protect yourself from threats to your health and safety due to severe cognitive impairments, that will also qualify for the care need requirement for out-of-state beneficiaries. And so the reason that those are different is that the care needs requirement that WACARES is using for in-state participants is based on the standard used in the state's Medicaid long-term care program. And that's different from the standard that's generally used in private long-term care insurance nationwide. So making the care needs requirement for out-of-state participants consistent with the nationwide standard will make it easier for the program to work with national vendors to assess those out-of-state participants' care needs. And then we've got someone asking whether WalkCares is pre-tax or post-tax. ESD, do you want to address that one?
It should be, it's based off of their gross income. So I guess that would be considered pre-tax, not the amount. It's based off of their gross earnings and not their net earnings.
Thanks, Jeff. And then we've got someone asking if we get a new employee from out of state, are they able to submit an exemption if they have long-term care, I assume private long-term care coverage?
So yes and no to that question, specific question. If they've already missed the cutoff to be eligible for the long-term care coverage exemption, so that would not get them an exemption. But if they are out of state, they could apply for the out-of-state exemption, which if they provide the required documentation, they would be eligible for and be exempt from the program.
And I think the question is a little unclear. If you're talking about an employee who just moved into Washington from out of state, then they would not be eligible for that exemption. But if
Correct.
it's a worker who is working outside of Washington, then they would be. And then we've got somebody asking for individuals who have been permanently exempted from participating with private long-term care coverage. What happens if they cancel their private long-term care insurance policy? Jeff, did you want to take that one?
Sure. So if you already have an approved exemption, it's up to the employee to decide whether to maintain or cancel their private long-term care policy. It's a permanent exemption. We by law can't cancel it or undo it. And they should speak with their broker or agent who sold them the policy to fully discuss their options.
Thank you. And then we've got a question about exemption options that says, I only see verbiage about veterans or spouses of military. What about those who are active duty military as Army Reserve and National Guard? Would they be automatically exempt? And do they need to apply for an exemption?
Yes, they're automatically exempt from the program based on their federal employment status. As federal employees, they're not eligible for the program.
Perfect, thank you. And then let's see, I'm just looking for one that we haven't answered yet. We have someone asking about whether there are going to be any changes made to the reporting website to be able to print a confirmation of the report that they file. This would be a nice feature to be able to retain a copy as an employer. Marley, do you want to address that one?
Currently, I do recommend taking a screenshot of the page.
Oh, Marley, you're a little faint. Can you maybe just try speaking louder?
Sure. Can you hear me okay?
That's a little better. Yeah.
So, and I'm sorry, can we repeat that?
They asked about whether it's possible to update the reporting website to be able to print a copy of the report that they file afterwards.
So of the actual report or the confirmation?
It looks like a copy of the report is the question.
Okay. I would recommend if you need that to, potentially print a copy yourself, and keep it on file, because that's going to be the same information that we have. But if you want a confirmation of anything that we can't currently print the document, you can take a screenshot of the page as well. Hopefully we'll be getting additional confirmations.
Okay. And then someone's asking anything to watch out for. I'm not sure exactly what they're thinking of, but when using a payroll provider, ADP, that takes care of filing on our behalf. Do you want to talk just a little bit about how it works to use a payroll provider?
So when you have that third party taking care of your payroll, payroll, I would definitely recommend still making sure that you gain access to your online account so you can take a look at the payments and invoices, and essentially have the same information that we do right there in your online employer account with full access. So highly recommend that. And we have a new process just in the last, I think, couple weeks that that employer agents can initiate an electronic power of attorney process. And so they do that right from their account when they're linking to an employer account. And then you're going to receive a notification, an email stating they have done that. And if you have not, and they'll be providing your email address to us as well. And so you'll receive an email at the address that was provided to us. And you can, from that point, go into your account or create an account if you don't already have one and gain full access. And you can approve or deny that power of attorney request in there. And so I think that those two things are going to be the most important in managing your account with an employer agent.
Thank you. Okay, we have someone asking for self-employed individuals who choose to opt in, but their monthly income varies. How do they pay the premiums? I'm wondering if you can just talk a little bit about how self-employed opt-in works for reporting.
Sure. So basically, you would file the report based off of the gross earnings. First of all, you need to opt in to the program. Assuming you've opted in, and we call it elective coverage, that's kind of what it's referred to as. You would report your quarterly earnings as a self-employed individual. And what we do to, if you're self-employed, what we do is we take your gross wages that you report, divided by the state's minimum wage to come up with the number of hours that'll be reported. So, like I said, self-employed businesses are not automatically included in the program, and you would need to opt in.
Thank you. Okay. And then we have somebody asking, how are employers notified when an employee no longer qualifies for a past exemption? I assume that is in relation to the conditional exemptions rather than the permanent private insurance exemptions.
Correct. The process is the employee needs to notify us, ESD, that they no longer qualify for their conditional exemption. And once they do not qualify, we will end it. We will send them a letter, and they are required to provide it to the employer. You do not have to stop withholding premiums until such time as you receive the letter, or start withholding premiums, I should say. You don't have to start with the holding premiums until they provide the letter that their conditional exemption is no longer valid, which we provide to the employee directly.
Thank you. Let's see. I think we mentioned this earlier, but if we can reiterate it, we've got someone asking if an employer can choose to pay the walk years amount for their employee rather than withholding it from their paycheck.
Yes, they can. An employer can pay the premium on behalf of their employee.
Thank you. Then we've got someone asking about for out-of-state coverage, if we also will be able to have for folks who have opted into out-of-state coverage, if they will be able to get coverage outside of the country. If you retired somewhere like Mexico and need care, the processes and policies that we're developing for out-of-state coverage are still in process. We're still working on those, and it's not yet clear whether we'll be able to offer out-of-state coverage outside of the US, but we should have more information available in the next couple of years. And then let's see. We've got somebody asking if an Oregon resident works for an Oregon company but works 100% of their time in Washington, how do we remit to Washington? Will the Oregon resident be able to get benefits from from WalkCares if we have to remit to WalkCares for their earnings?
So let me address the beginning of that. If they are out of state, they reside out of state, but work in the state of Washington, they would qualify for an out-of-state exemption should they choose, first and foremost. If they choose to continue to contribute, like Kristen was just saying, we're still developing exactly what those out-of-state benefits would look like. And it's, basically more to come. But if Kristen, if you wanted to touch a little bit more on the out-of-state benefit piece, we would, but they could most definitely apply for the out-of-state exemption.
Yeah. So if you are earning WellCares benefits and then move out of state and need care and while you were a resident in another state, then you would need to become an out-of-state participant in order to get care out of state. And then let's see. We've got someone asking for guidance when the employer has made multiple requests for PIN letter to access their account. Is that something we can answer?
So making multiple attempts and I'm guessing, I guess I'm not really clear on what the issue is.
I think maybe that's a,
Just
oh,
making
go ahead,
multiple
Jeff, if you have
attempts
an
for the
answer.
PIN.
I was going to say, if they made multiple attempts to get a PIN, one solution would be to call in, let us help you with that. That's a very specific issue, and there could be a lot of different reasons why. And we can identify that for you and help you out with that. You can contact us via email or a phone call.
Thank you. And then we have someone asking, are employers required to provide or post WellCares flyers to employees? And the answer to that is no. There's no requirement in the law for employers to communicate with employees about WellCares. We do find that it can be really helpful for employers to take the toolkit materials that we have available on the website and use them to communicate with employees to help address some of the questions that we know HR departments have been getting since the start of the program pretty consistently. So we do recommend it, but it's not required. And then let's see. We've got somebody asking. Just looking for something that we haven't answered yet. We have someone asking if we have more detailed information regarding the retirement payments that do not get included in gross wages. Do we have any info we can share on the definition of gross wages for that one?
They would be the same rules as paid leave. So on our website, it does break down in the employer toolkit exactly what is considered a wage and what can be excluded. Retirement income is definitely one that should be excluded.
Thank you. And then we've got someone asking, when a conditional exemption no longer applies, how is the effective date to start withholding premiums determined?
So once the conditional exemption is no longer valid and they've received a letter from ESD, there will be a letter, an effective date in that letter. And that's the day that you could start withholding the premiums. You don't have to go retro back. It's just whenever the employee provides it. And I believe it's the first day of the following quarter. Everything we do is on a quarterly basis. So on the first day of the following quarter, you can start withholding.
Thank you. Okay. We've got someone asking, do H-2A workers need to get exemption letters?
Absolutely. If H-2A workers do not want to pay into the program, they will need to apply for and receive the non-immigrant visa exemption. and that's specifically for H-2A type of workers and some other specific types. They would need to apply for and receive that approval letter and provide it to their employer, at which point the first day of the following quarter, it would go into effect and you would stop withholding.
Thank you. And we've got several questions about what happens when you reach the $36,500 limit for WellCare's benefits. Essentially, WellCare's would no longer be able to continue paying for your care. We expect that for a lot of families, having access to a WellCare's benefit will give them breathing room to plan how they will pay for future long-term care costs, including learning about how to qualify for Medicaid long-term services and supports. It may be that they will qualify financially to move to Medicaid long-term care after their WellCare's benefit is exhausted.